Hello, I'd like to tell you about the Ellen Medical Affordable Dialysis System, an initiative of the George Institute for Global Health. In 2015, the George Institute published a landmark paper in The Lancet of a study of global access to dialysis. This study showed that around 2.6 million patients around the world were receiving dialysis, but shockingly another 6 million were dying each year because of lack of access. A global epidemic of diabetes and high blood pressure is driving rapidly rising demand for dialysis. Current estimates are around 16 million patients need dialysis, but of those, 3 out of 4 won't get it and will die from their disease. At Ellen Medical, we aim to solve this by tackling cost and accessibility. Hemodialysis is invasive, expensive, and a huge economic burden on a patient who must attend a clinic for up to 6 hours at a time, 3 times a week. It's difficult to hold down a job when you've got to spend so much time on treatment, and impossible if you don't live close to a clinic. The alternative is peritoneal dialysis, in which fluid is infused into the peritoneal space around the gut and later drained out along with the waste products. It can be done safely at home, allowing the patient to continue to work and to support their family. But it requires the shipment of more than 3 tons of fluid bags to the patient's home every year. Here's just 1 month's supply stored in a patient's bedroom. This can be done in Western markets where there's good infrastructure. It's far more difficult in the congested cities of the developing world, and just not viable in remote and rural areas anywhere. The challenge demands scale. If we could reach those 5% of patients just below the current affordability threshold, that'd grow the market by around 1 million patients a year. A cheaper dialysis would also help those who are underserved, who skip treatments for reasons of cost with poor outcomes, and would disrupt Western markets, taking share from current high-cost providers. We've developed a home-use device to distill tap water into medical-grade sterile water and automatically fill a bag of dried dialysis salts at home, effectively manufacturing the PD fluid bag at point of care. This is a scalable solution. It's got none of the high capital costs of in-clinic hemodialysis and removes the need to ship all of that water. We've developed a prototype distiller and taken it into the homes of dialysis patients in a clinical trial. We've shown that unsupervised patients can prepare bags at home which are sterile, meet the requirements for dialysis fluid, and are identical to the current standard of care, and critically, don't change the clinical workflow. Now we need to take the next steps of developing our first generation clinical device, along with a lightweight bag that can be shipped dry through conventional local delivery channels. The Ellen Medical Dialysis System will bring hope to those currently not treated or underserved, making dialysis affordable and accessible everywhere.